This conference will now be recorded.
Good morning, good afternoon, and good evening, everyone, wherever you are. Thank you very much for tuning in to this information session on the Egypt Clinical Scholars Research Training Program. My name is Youssef Farag, and I'm the co-director of the Egypt CSRT program. I'm also a faculty director at the Postgraduate Medical Education Department at Harvard Medical School. I am honored to be co-leading this program with Dr. Kenneth Christopher, who's the program director of the Egypt CSRT, who's also a faculty director at the Postgraduate Medical Education Department at Harvard Medical School. This program is one of many programs that the Egyptian Ministry of Health and Population has contracted with Harvard Medical School through a couple visits that Her Excellency Minister of Health, Dr. Hala Zaid, visited to Harvard Medical School over the past couple months. Today, I'm going to give a brief overview of the Egypt Clinical Scholars Research Training Program. You can also find more information about these programs in the links provided in the screen. So why do you do the Egypt CSRT training program? So first, you would develop practical skills in conceiving ideas and implementing these ideas to success. This goes all the way from identifying a research question, writing research proposals, all the way to writing papers and manuscripts. You'll also develop a deeper understanding of research methodology and design. Along the way, you will develop a lot of soft skills that are integral component of being a successful researcher, including teamwork, negotiation, and leadership. Most importantly, you will also develop an international network of researchers and professionals. From Harvard Medical School, Harvard University alumni, you will be networked with a global pool of colleagues and also get into the HMS network of researchers and professors. The Egypt CSRT training program leverages faculty from top Harvard hospitals. Within less than half-mile radius, there are several top world-renowned hospitals and research centers that are affiliated with Harvard Medical School. The learning model of the Egypt CSRT training program is hybrid or blended learning. It's a course design that combines traditional face-to-face class time with online and out-of-class coursework. The case-based learning involves teamwork and leadership, and there are also team-based learning that involves team assignments and presentations. The program overview starts with a workshop that takes place in Cairo, Egypt, followed by several activities involving recorded online lectures, attending live webinars, quizzes, and a capstone, and then a final exam that precedes workshop 2 that also takes place in Cairo, Egypt. For the top 5% of the class, they get additional online lectures, and then they travel to Boston, Massachusetts in the United States at Harvard Medical School for an immersive experience in a clinical research workshop for 1 week. Workshop 1 involves Introduction to Epidemiology, Biostatistics, and Stata, which is one of the statistical computing programs out there. Workshop 2 focuses on clinical trials, epidemiology, scientific writing, and leadership. The core curriculum of the Egypt CSRT program involves Introduction to Epidemiology and Biostatistics. It also involves biostatistical computing, ethics in research, applied regression, survival analysis, correlated outcomes, and then clinical trials, and finally teamwork and leadership, which are critical components of the soft skills that are involved in being a successful researcher. The student experience at the Egypt Clinical Research Training Program is a 24/7 availability of on-demand video materials, convenient webinars, networking at workshops with other classmates and Harvard professors, complimentary access to the Harvard Medical School Countway Library for millions of articles of PubMed, The time commitment of the Egypt CSRT program involves approximately 7 to 10 hours per week, and then you get a certificate of completion from Harvard Medical School. You will also be eligible for an associate alumni at Harvard University without having a Harvard email. The Egypt CSRT training program culminates with a capstone project. The capstone project is a 4-page proposal. It involves having a Harvard advisor who gives you feedback on 2 discrete occasions on what you write. The capstone projects are competitively evaluated, and they are assessed based on innovation, feasibility, and presentation. The project has to be on patient-oriented research. So basically, we do not accept animal studies or cost-effectiveness studies or meta-analyses, for example. Each capstone proposal will require a letter of endorsement from the supervisor, chair, or hospital director to ensure that there is institutional awareness and endorsement for the project that you are conducting. If a participant fails the capstone by getting a score 4 out of 5 or less, or fails to submit a complete capstone by the submission deadline, they will not receive a score that contributes for their weighted composite grade for graduation. But most importantly, since the capstone accounts for 50% of the composite weighted grade, the net result will be that the candidate will not be able to graduate from the program. However, remediation for the capstone may be possible only on a case-by-case basis. Assessment in the Egypt CSRT program is weighted through the following components. As I just mentioned, capstone 50%, formative quiz completion 10%, attendance to the workshops and live webinars 10%, and final examination 30%. A pass will be given at or above 70% of the grade, and distinction will be at or above 90% of the grade. You will get upon completion a certificate from Harvard Medical School. Will be presented at graduation ceremony that will be held in Egypt. The certificate requires completing all academic requirements, but also meeting all attendance requirements. The certificate will note honors achieved in capstone, whether distinction or commendation. So who should apply? Candidates who are eligible for the ECSRT are physicians, those who hold an MBBCH degree, dentists, pharmacists, and also nurses. Although clinical research experience is preferred, it is certainly not required. So it is perfectly okay not to have a clinical research experience before applying to the Egypt CSRT program. The final selection of the applicants is conducted by Harvard Medical School and will include critical review of the application materials, which includes the candidate's CV and the participant prepared 250-word essay expressing his or her interest in the program and how you will benefit from it. So in summary, the certificate program focuses on clinical research training. The skills and knowledge you will acquire in clinical research involves epidemiology, biostatistics, scientific writing, clinical trials, and leadership. You will be instructed by world-class faculty from Harvard Medical School and its affiliated hospitals. And there's also ample opportunities of networking in this program. This concludes my presentation. Thank you very much, and I'm looking forward to seeing you in Cairo for the Egypt CSRT program.